So where have we been and where are we going? I'm going to tell a short story. It's a little bit of a walk down memory lane, only this memory is only about 2 months old. So where we are today and what does our future hold? I'm really using our communication plan to guide this story, so I want to make a special thank you to Wendy Gordon, who has led our communication strategy since late in February. I'm hoping that you'll get 3 main messages out of this quick walk down memory lane. First message is we had the first case in Oregon, and what does that mean? What does it mean to be first? The second is the importance of incorporating equity, which we have tried to do since day one of this response. And then the last thing I want to convey is what do we need to move towards our new normal? So I'm going to start with a timeline. So we can go to the next slide. So as I started this, I thought I had the timeline on one slide. And then I realized, oh my goodness, so much has happened in 2 months. So this is very high level, just to give you an idea of what's been going on. A reminder, we've all been living through this. February 28th was when Washington County was notified that we had the first case of COVID in our community. This case was not linked to travel or any known risk factors. So what that told us is there's already community spread. We knew now the virus has been circulating before February. March 3rd, we activated our Emergency Operations Center and really focused on slowing disease spread. March 4th, Washington County Board of Commissioners declared the first declaration of emergency. The state of Oregon declared emergency on March 8th and the United States on March 13th. So again, we were first. March 11th, the World Health Organization declared COVID-19 a global pandemic. Next slide. The beginning of our restrictions, in case you're wondering why it feels so darn long, and I agree. March 12th, the governor banned all large gatherings of 250 or more. On March 17th, they banned gatherings of 25 people or more, and on the premises, no food or drink consumption. So you had to only have curbside pickup or delivery of food, restaurants basically closing. And then orders to close schools until March 28th and included higher education beginning on March 19th.
April 28th.
April 28th. Stay closed until April 28th, yes. So March 23rd, stay home, save lives, the governor's executive order that we've been living in since. And this is really working. It is flattening the curve. OHA has estimated that this March 23rd order that we're all following, we're all staying home to save lives, has prevented as many as 18,000 COVID infections. April 3rd, CDC releases guidance advising non-medical face coverings when in public. And we've been wearing our face coverings, but right now we're very socially distanced, and so many of us don't have it on. And then April 8th, the governor extended school closures and higher education closures through the end of the year. So that's a lot that's happened just in a couple of months. So I'm going to move to what does it mean to be first. So in a lot of our outbreaks that public health has to address is something like measles or salmonella or shigella. They've been around for a long time. We have protocols. We have standard operating procedures. We have standard interview tools. We have standard public information tools. We have standard information that we provide to families who are infected, maybe, say, with measles. You might remember that a few months ago. So this was a novel virus. That means we don't have very much information. We don't know a lot about the infection. We're looking at what's happening in China. We were looking at what was happening in South Korea, in Europe. trying to learn from that. But being the first case in Oregon, we had to develop case interview protocols. We had to develop plans. How are we going to quarantine contacts? How are we going to isolate cases? What if their family is large and the person that's sick doesn't have a place to isolate from the rest of the family? What are we going to do for these families that don't have an income now for 2 weeks? And now it's 4 weeks because somebody else became sick. And now it's 6 weeks that they have no income. And they're being told they can't go grocery shopping. They can't go out of their house. What is the education that we need to provide? How do we provide that in different languages? What does the public need to know? And how do we provide that? All of that, Washington County had to develop. Of course, we had support from our partners in neighboring counties who didn't have cases yet, and we had support from Oregon Health Authority, but we started it. We had to develop all of that. Okay, we'll move on to phase 1, where we started. We also needed to address the social and economic needs of those impacted, both the cases who were isolated and contacts who were in quarantine. So this was about slowing the spread of the disease. We had to interview all the new cases, perform contact investigation, identify people, and give them instructions on how to stay home safely. Equity was really important during this time. At the time, there was a lot of stigmatism and racism, and there continues to be concern around that. People didn't understand, where did this come from? Why are these people sick? What did they do? And so we really had to address that. We had to do that by understanding who our cases were. We had to protect not only the individuals from stigma, but communities from stigma and racism. So that's why in the beginning, we weren't providing a lot of demographic information or data, and people didn't understand that, and they were concerned about that. But it was really about protecting individuals and communities. It also meant sharing information about signs and symptoms of the infection at the time, testing information, when to seek health care, and how do we provide that in several different languages to several different cultures in a way that they could hear the information and understand the information. In order to do that, we needed to rely on trusted community partners and our social media help for these early messages. So then we moved on to what we're calling phase 1A, slow the disease, gain knowledge, and educate the community. We had public health nurses, our health officer, and others that were continuing to work 7 days a week to identify cases, interview the early cases, and provide contact tracing, including notifying work sites, and providing information to the public about how the disease was spreading. Around equity, with the new recommendations, at this point, we had new recommendations from the governor around staying home, saving lives, and then eventually the recommendations around face coverings. So we had concerns that were raised. People from communities of color told us, we don't feel very comfortable wearing face masks. And so we had to work with communities to make that more, to raise their comfort level, to understand what the concerns were, to communicate that to their neighbors and their friends, and to help local law enforcement because we knew that there was bias reporting happening. We had reports of it into our office. We had reports of things like families who had positive cases or somebody assumed they had a case that were put on neighborhood watch lists. We had cases of people walking by Asian families and throwing masks or cloth coverings onto their porches with slurs. So we were addressing all of those kind of issues that we were seeing in the community. And again, we couldn't do that alone. We had to rely on the help of our other community-based organizations that work with these populations. We also had to continue to monitor the data and identify disparities. And so some of our communication and our work has really focused on communities that are more impacted by this. So we're getting more and more information out, again, to migrant farm workers, to the Latino community, because in Washington County, they have been more impacted. We also had to continue to deliver food. We provided hygiene supplies and ensuring that the information was provided. So phase 2. So we haven't really yet begun phase 2. We're heading towards phase 2, but we're not there. So phase 2 is really about looking at the social distancing measures that appear to be working and making sure at this point that we stay strong and continue these strategies, that we stay connected socially, but that we stay distanced physically. We're also now focusing, this has been a long time. A lot of us are tired of this. A lot of people in our community are really suffering. They've lost jobs. They've lost contact with loved ones. It's not the same to FaceTime. I know from experience, it's not the same when I FaceTime my little 3-year-old granddaughter. That's not the same as when she came over and we could hug and kiss and dance and sing together. So we understand that this is really hard, but this is where we are. We're in phase 2 of really needing to stay strong and move us towards relaxing those restrictions. So the final phase will be really led by our governor, and she's the one that will help us with the roadmap, and we're working together with Oregon Health Authority and with the governor's office to identify how do we assure that we have testing available for anybody who wants it. How do we assure that our public health system is strong and sustainable, and that we can isolate, we can do case investigation quickly, we can isolate, and we can quarantine anybody that's been exposed to somebody who's sick. What we ultimately have to work towards is herd immunity. And herd immunity is really an estimate of at least 50% of our population being covered with a vaccination. It means that people won't be as susceptible to this disease. In the meantime, we are going to have some restrictions in place, but we are beginning to work on a plan for how do we move towards loosening those restrictions, making sure that we have adequate testing, isolation and quarantine, and that we can rapidly ensure that people have access to health care, and if they do become sick, so that we have an adequate health care system. The other piece that we'll need to do is make sure that we begin, and we're starting to work on this in both the public health arena and at our emergency operations center, and all of our elected officials, including this board, are beginning to talk about what does the economic recovery look like as well. So we have the next slide. We have received federal and state criteria, and most of that I've mentioned already. Really more testing capacity in every region of the state. We need to continue to see the decline in positive tests. We need to be able to provide safe quarantine and recovery locations, including for families, including for our migrant visitors that are coming into our community. We need to assure that there's adequate personal protective equipment, and we need to be able to trace all of the close contacts for anybody who tests positive. The White House has also released similar criteria, and the governor is looking at how that criteria would be applied in the state of Oregon. There's important criteria that has to be met before we can start loosening those criteria. And the way that we're going to get to that is my last slide. The way that we'll get there is by continuing to stay home and stay safe. So again, this is the last slide. We're still in this stage. And by folks really complying and cooperating with this just a little bit longer, we need you to hang in there. That's what's going to move us toward the criteria of fewer people becoming sick, fewer people hospitalized, improved healthcare capacity, and the ability of our public health system to do case interviews and isolation. That's what's going to move us out of these restrictions. And that's what I have. If there's any questions, I'm happy to